Ich begrüße Sie.
I cordially welcome you to the presentation of this year's BEMER Science Awards. This is already the third time. This year, a scientist will be awarded for his outstanding services in his work on relationships and uses of the BEMER system in peripheral arterial occlusive diseases.
Ich bin sehr froh.
I am very happy that the BEMER company has taken such an upswing in recent years. Why? Because the BEMER therapy does much more than what was originally articulated. There are obviously a lot of effects that are not known to date, have not been scientifically investigated further by, but are very probably already clarified through the successes and also recognized among patients. Therefore, BEMER therapy is particularly well suited as a complementary base therapy to improve a disturbed microcirculation.
It is a great honor for me, the invitation, the celebration, the winner of this column. I'm very glad to hear, and I present a study which was introduced in Medical Center Hungarian Defense Forces. I am the chief doctor of the angiology. I am an angiologist, as you heard, and a hemorrhagist also. It is well known that the angiologists have only a limited treatment possibility in the peripheral arterial obliterative disease. Only some drugs, as pentoxifilline, sulodexid, naftidrafuril, and in severe obliterative disease, critical leg ischemia, the prostavazine, for example. And so I was very glad when I can read Dr. Klopp's book in 2008. And I can read that this is a treatment, the BEMER treatment, has an effect on microvessels. Dr. Klopp showed out that during the BEMER treatment, the spontaneous vasomotion increased. The number of opened capillaries increased. The number of connected capillaries increased. The local PO2 and arteriovenous PO2 differences increased. The arterial and venular blood flow increased. On the other hand, we have the pentoxifilline infusion therapy, an effect on blood rheology, blood vessels, BEMER, and blood rheology, the flow of the blood. Pentoxifilline has an effect on deformability of red blood cells, deformability of white blood cells, and aggregability of red blood cells decreased, the deformability increased, the aggregability decreased, and so in the microvessels, the diameter of these vessels less than 200 micrometer, the blood flow better than before. And this was the aim of our study. We took a placebo BEMER pentoxifilline study, PBP study, in Budapest from 2011 to 2012. The aim of the study was that, on the other hand, the BEMER therapy to the vessels, effect on the vessels, and on the other hand, a pentoxifilline infusion therapy effect on microrheology, and will be a better microcirculation, we hope. The patient's inclusion criteria were typical symptoms, claudicatio intermittens. The patients have a pain-free walking distance, and after a distance appears a pain in the leg and must to stop. And after a little moments, the patients can go forth. We selected the patients suffering from stages of Fontaine 2E and 2B. In this stage, the patients have a pain-free walking distance in 2A more than 200 meters, 2B less than 200 meters. We took the physical examination, palpation of arteria femoralis, arteria popliteal, arteria dorsalis pedis, arteria tibialis posterior. We measured the ankle brachial index. We measured the blood pressure, the systolic blood pressure over the ankle and over the arm, and divided these two numbers. And if this ankle brachial index less than 0.9, this is a diagnostic value for the obliterative arterial disease. We took the Doppler examination. We gave pathological blood flow curve or post-occlusive curve, or we cannot detect blood flow in these arteries. The exclusion criteria were Fontaine 3 and Fontaine 4 stage, because in Fontaine 3, the patients have pain in rest. We couldn't measure the pain-free walking distance because in rest have patients suffer from patients in rest, in bed. And in Fontaine 4, the patients have a gangrena and couldn't walk. We excluded patients suffering from coxarthrosis, gonarthrosis, spondylosis, discopathy, and lumbago, because in this situation the patients couldn't go because this illness not in arterial disease. We excluded the patients suffering from serious cardiac or pulmonary disease, for example, chronic ischemic heart disease, angina, heart failure, chronic obstructive pulmonary disease, because dyspnea. Following to take into account of inclusion and exclusion criteria were we have 30 patients till the end of the study. The methods. The type of the Doppler apparatus was a SmartDop 45 bidirectional blood flow meter, a waveform display, and a printer. It was made by Japan Hedeco Incorporation. The treadmill equipment was the Schiller MTM 1500. It was made in Switzerland. The setting of the equipment were the following: 3.6 kilometers per hour constant speed and 0% slope. The structure of the study. On the first day, we took the medical history of patients, physical examinations, ankle brachial index, Doppler examination, measure of pain-free walking distance, and maximal walking distance. Maximal walking distance, it means the patients can walk with pain, the maximum, but with pain. From the first to 7th days, it was the placebo period, and on the 7th day, we took the second treadmill examination. From 8th to 15th days, it was BEMER treatment period, 2 times a day P1 mattress and P4 program, 2 times a day, 20 minutes, pillow over the ischemic leg. During 8 days, these was 16 treatments. On the 16th day, we took the third treadmill control, PFWD and MWD. On the 7th from 17th to 24th days, it was pentoxifilline therapy period. In this period, the patients gave 2 times a day 250 milliliter salzole infusion, 2 times a day 200 milligram pentoxifilline per day, same 16 treatments. On the 25th day, we took the 4th treadmill control. This is the structure of our study. First, the placebo period. Second was the BEMER period. The third was the pentoxifilline period. And this time, which we can, the treadmill 1, 2, 3, and 4. The treadmill examination. The equipment was, the speed was 3.6 kilometers per hour. The slope was 0%. The patients walk in this treadmill, and when appear the pain in his leg, he said it. But in this moment, we didn't stop the equipment, go forth, and when then the pain will be stronger and stronger, and the patients must to stop. It was the maximal walking distance. About the results. Here we can see the changes of pain-free walking distance in meters during placebo, BEMER, and pentoxifilline infusion treatment. The mean value of pain-free walking distance before placebo period was 72 meters. After placebo period, 78 meters. After BEMER treatment, during BEMER treatment, increased this mean value to 124 meters. And after infusion treatment, increases 143 meters. Here we can see the maximal walking distance during placebo, BEMER, and pentoxifilline infusion therapy. The mean value of maximal walking distance was 140 meters before placebo period. After placebo period, it increased to 156, and after BEMER increased 213, and after pentoxifilline increased this distance to 257 meters. Here we can see the extreme and standard deviation. Here we can see the efficacy of different treatments. During the placebo period, the pain-free walking distance increase was 8.7%. In the medical literature, we can read that in the general practice, the placebo effect of treadmill about 10%. And this is same value as we can read in the medical literature. During the BEMER period, the pain-free walking distance increased with 57%. During the infusion therapy, increase was 15%, more 15%. The combined treatment, the BEMER plus infusion therapy, during the increase of pain-free walking distance with 81%, 82%. Here we can see the increase of maximal walking distance, placebo, BEMER, infusion, and combined treatment. During the placebo period, this increase was 11%. During BEMER treatment, 36%. During infusion therapy, 20%. And during combined treatment, 84%. This is a very great result. Here we can see the mean, the extreme values of pain-free walking distance before BEMER, after BEMER, and after infusion treatment. And here we can see the significancy of the increase. The increase is a very significant during BEMER period, 0.05, and also significant during infusion therapy, 0.04, and the combined therapy, during the combined therapy, the increase is a very, very significant 0.0003. And here we can see the maximal walking distance during BEMER and pentoxifilline therapy, the mean values, the extreme values, and significancy. The increase was significant. The p-value was 0.04 during BEMER, but wasn't significant during pentoxifilline therapy. The p-value was equal 0.1. Here we can see the efficacy of BEMER therapy, pain-free walking distance. We determined the efficacy ineffectual when the increase of pain-free walking distance was less than 15%, because I mentioned above that the placebo effect of treadmill treatment about 10%. And we determined that ineffectual the therapy if the pain-free walking distance increased less than 15%. The efficacy was weak if the increase of pain-free walking distance was between 16 to 50%, was good between 51 to 100%, and was excellent if the increase was more than 100%. And so the efficacy was ineffectual in 7 patients, was weak in 10, was good in 5, and was excellent in 8 patients. Here we can see the combined treatment, BEMER plus rheological treatment efficacy. If ineffectual was in 5 patients, weak in 4, good in 7, and excellent was in 14 patients. Here we can see the non-responder patients, pain-free walking distance change during placebo, during BEMER, and during infusion therapy. We can see no elevation of the value during placebo and during BEMER, and during infusion also, except 1 patient who has an elevation of pain-free walking distance, but only under the infusion therapy and not BEMER. And here we can see the responder patient. mention. That is a question. what is the cause of ineffectual therapy of BEMER and ineffectual therapy of infusion therapy? In the medical literature, we can read that the cause is the lack of outflow of the blood in the leg. We didn't study the cause of ineffectuality of BEMER therapy, but I think the cause is same as in infusion therapy. Here we can see the responder patients. We can see that placebo period, no elevation of value of pain-free walking distance, but during BEMER therapy, we can see an elevation of pain-free walking distance, except one patient who value elevated during BEMER, but not during infusion therapy. The efficacy of BEMER treatment was good and excellent in 43% of the patients. The efficacy of combined treatment was good and excellent in 70% of the patients. This is a very good result in this illness. And we determined that BEMER therapy has a favorable effects on microvessels. The pentoxifilline therapy has a favorable effects on blood rheology, and together took a better microcirculation, descending ischemic pain and symptoms. Thank you very much for your attention. Thank you very much.